This podcast is brought to you by the ATMS, the Australian Traditional Medicine Society. This is FX Medicine. I'm Andrew Whitfield Cook. Joining us on the line today is Dr Carolyn Ee, who's a GP and Research Fellow at the National Institute of Complementary Medicine, that's NICM, in Western Sydney University, and was one of the first practicing medical doctors in Australia to gain dual qualifications in Chinese medicine. Dr Ee specialises in clinical trials on acupuncture in women's health and is the current chair of the Royal Australian College of General Practitioners, that's the RACGP, Integrative Medicine Specific Interest Group. She also leads the JACA Foundation Integrative Medicine Program at NICM, which focuses on clinical service delivery, education and translational research in integrative medicine. Welcome warmly to FX Medicine. Carolyn Ee, how are you?
Hi, very good, thanks.
Now, Carolyn, we're going to be talking today about the relevance of acupuncture for polycystic ovarian syndrome. So there's all these acronyms flying around the place, PCOS. Can I just ask first off, PCOS, PCOD, is there one that's more appropriate now?
Oh, that's a really good question. It's PCOS at the moment, which is polycystic ovary syndrome. But I know that there's been some discussions around changing the terminology. But for the moment, it is a syndrome, and it refers to, I guess, a syndrome is a collection of signs and symptoms. So it's not seen as a disorder so much.
And of course, we have to go back to your beginnings because you are dually qualified. What made you undertake medicine in the first place and then drew you to Chinese medicine and acupuncture?
Yeah, look, I wanted to be a doctor from the time I was quite little. I wanted to help people, basically. And I really enjoy the clinical interaction with patients. But I think, when I was a junior doctor, it was quite an eye-opener. All my time was spent in hospitals with really sick people, and often they didn't seem to be getting better, and a lot of people came in because of iatrogenic side effects, so side effects from taking pharmaceuticals. And I just wondered if there was other ways to help my patients get better, if there was a way to help them achieve better health and well-being. And I was really interested in the philosophy of Chinese medicine, and it's fascinating because it's tied into the religions, Buddhism and Taoism. It's tied into martial arts. So there's a sort of underpinning philosophy that I found really interesting and that was, diametrically opposite to, I guess, biomedicine. And so I decided as a very young junior doctor after doing 3 years in the hospital system that I needed to really pursue that and go into it on a very deep level. I didn't want to just do a couple of weekend courses. That wasn't going to satisfy me at that point. So I decided to do another undergraduate degree at RMIT, and I think it was the best decision I ever made. That was the Bachelor of Applied Science in Chinese medicine, and did that in 3 years, so got exemptions for some of the other subjects, went to China for 7 months, did all that, learned about Chinese herbs, and graduated, and then started to go about thinking about how I'm going to combine the two medical degrees.
I could imagine that you would have copped some flack from your peers, from your cohort in medicine, going, "Oh, she's one of those," sort of thing.
Yeah, look, it was interesting. I think early on, people are a lot more open to things. I think there's a lot more skepticism now, to be honest. But people were fairly welcoming of that. They saw that I was pursuing something I was passionate in. Interestingly, one colleague of mine who is from China, a doctor colleague, told me that I was making a terrible decision. He was probably the only one who said that.
Yeah.
But I don't regret it at all. It's really it's really changed my outlook on health and how we view health. And of course, I've come back to biomedicine. I'm a practicing GP now. I consider myself a doctor first and foremost. And these are all the additional tools in my toolbox.
Yeah. I think it's funny when people sort of poo-poo something without knowing about it.
Yeah.
As you mentioned, you take it back to martial arts and Tai Chi and things like that. Well, anybody open to mindfulness or?
Yeah. That experiential stuff, can really change the way that a doctor or any health professional sort of looks at the human body and how it works, I think.
What about the history of acupuncture itself? When you were taught acupuncture, surely you had to delve back into the history. But how did it make its way into modern medicine, particularly in Australia, I guess?
Yeah. Look, I think I would say that one thing that got me into research was that we were taught a lot about the history of Chinese medicine, the history of acupuncture and herbs and so on. But no one really told me how it all worked. And I was, as you say, I was searching to, how does it work and what's the mechanism? And I was just told sort of 2,000 years of history. And that's enough, or that, 2,000 years worth of anecdotes. And I thought, well, no, I really want to know and use my scientific mind to find out. But if we go back to the history of acupuncture and its use, so I think originally people think that it might have originated from findings thousands of years ago that if someone was injured, with sort of lacerating injury, that they had some kind of pain-killing effect. And if soldiers were at battle and they were pierced by something, it seemed to have this sort of contradictory analgesic effects. And so found, I think, acupuncture needles that were made of bone, that were obviously quite big and probably quite invasive thousands of years ago. And then over time they evolved into, I think they used various types of metal. And of course now we've got the really modern acupuncture needles that are all very thin and produced, according to very strict manufacturing conditions, and they're all sterile and one use only and so on. And they even have a guide tube, so it's all, so it protects the shaft of the needle from, handling with hands.
Ah, of course. A
so,
CCSD.
Yeah, exactly. And then in the West it became very popular probably after the 70s, where there was a lot of interest after Nixon went to China on a tour, and one of his staff, I think reportedly had appendicitis and had the appendix removed under anesthesia that was augmented with acupuncture, and that was a really, that was obviously that sort of life-changing, wow, I've experienced the event, and it became much more popular in the West after that, after some seminal research by J.S. Hahn, where he did, I think it was on rabbits, and he gave acupuncture to one group of rabbits, and then he took out the cerebrospinal fluid, so the fluid that sort of bears the spinal cord, and then he injected that into the cerebrospinal fluid of other rabbits, and then he found that they had this, it had this analgesic effect, so he deduced that it was something in the CSF, and we found that it was endorphins that was responsible for the pain-killing effects. So I think establishing that the physiological mechanism of acupuncture has really led to, I guess, its popularity in the West. So I'm a medical acupuncturist as well. So I, after training in Chinese medicine, I did the grad cert in medical acupuncture at Monash. So I can give acupuncture to my patients, and they get Medicare rebates for it. So that's, I guess that sort of represents the embracing of this modality amongst medical doctors, and there's, medical acupuncture journals and societies and so on.
So is the medical use of acupuncture, is that restricted to the use for pain?
It certainly is now in the guidelines for as a first-line treatment for low back pain. So, for example, I think it was quite recently, a year or two ago, it was the American College of Physicians releasing their guidelines on management of acute and chronic low back pain. Yeah. And acupuncture's in there as one of the first-line treatments. So you try that before you ever go to, more dangerous things like opioids, I should say. So, the fact that it's there to the guidelines, it clearly indicates that there is a recognition that it's effective for pain. But what I'm really interested in, and which brings it to the polycystic ovary syndrome that I'm researching at the moment, is its effect on the sympathetic nervous system, so the fight-or-flight response. Oh. And there's really interesting data coming out that's very early, but I think, potentially really powerful at the effect of, not just on the opioids, which is reasonably well established, but on things like your adrenaline levels and the balance between the sympathetic and parasympathetic.
So we're talking about vagal nerve stimulation here.
Yes, we are. Yep, absolutely. And we're also talking about reduction of the other side, so the sympathetic nervous system. And that seems to, so increasing the parasympathetic and decreasing the sympathetic. And that brings that's got an impact on things like insulin resistance. And so that's got a lot of different ramifications for many types of chronic disease.
Now, this is really interesting because I've spoken a couple of times to Emrys Goldsworthy about this. He uses various ways of innovating the vagus nerve by, gargling, singing, and I think there's an inner part of the auricle of the ear.
There's a few things,
So, but is that where you administer the acupuncture, or do you administer the acupuncture to other sites where you're accessing the vagus nerve?
So the vagus nerve can be accessed through the ear. So we are using ear acupuncture in one of our trials. And we're actually trialling a new device that's FDA cleared but is not currently available in Australia that will provide what we call protracted acupuncture to the ear. So it's actually pitched as sort of neuromodulation, and it's really taking, the roots of acupuncture and applying a very modern take to it. And what I'm really excited about is that there were a couple of trials published in the Australian Family Physician actually many years ago, but this study looked at the effect of ear acupuncture on appetite, and reported that needling the ear and stimulating the points in the ear seemed to reduce appetite. And so what we're trying to see is this one of the potential mechanisms, as well as the effect on the sympathetic nervous system, that can help women with PCOS manage their weight? Because if they manage their weight, which is quite difficult for them to get on top of, then it can really significantly change all the other aspects of their condition. So it can improve their fertility, it reduces risk of diabetes and so on, and it changes the physical signs as well, so they have less acne and less excessive facial hair.
This is quite stunning if this is going to have a clinical effect, because you're accessing a vagal nerve and you're dampening a multitude of biochemical processes or aberrant biochemistry by accessing one pathway. This is huge.
Yeah, I think so. And I was a bit sceptical about the effect of acupuncture on metabolic disorders and overweight, obesity. I thought, well, how can you lose weight if you lie down on the couch for half an hour, once a week and have some needles put in? And I thought, no, that's rubbish. You have to, eat well and exercise more, and it's quite simple. And then I started looking at the evidence on this, and the evidence was really surprising that it's often quite hard to show a difference between acupuncture and sham acupuncture. And the reason is that there's no placebo for acupuncture. Anything that you use as a sham is going to have some effect, because the patient's got to believe that, the needle's being inserted. So in that way, the difference between the two types of stimulation is really quite small. But what I found from the systematic reviews that I that came up in the literature search was that there was a distinct difference, and quite a clinically significant difference as well, between acupuncture and sham acupuncture for managing obesity and overweight. Now, the studies tend to be a bit small and the quality is not great, but the evidence is really compelling, I think.
Can I just point out to our listeners, though, Dr. Ee, that you are indeed expert in sifting out the issues of sham acupuncture, correct?
Yes, that's correct. And so for my PhD, which I submitted in 2016, I ran a randomized sham control trial on acupuncture for menopausal hot flushes. So I used what we call a non-invasive sham needle. So it's a blunt needle. It doesn't go through the skin, but it still does provide quite a bit of sensation because it's quite thin. It's about the same width as an acupuncture needle. If you can imagine, sort of, the pressure on a narrow point is quite noticeable. Yeah. And of course it has to be noticeable because the women need to believe that the needle's gone through the skin. So we didn't tell them that it was non-invasive. We said it was a different type of needling. And we eventually included quite a number of women who had acupuncture before. So I think the cutoff was sort of a month. And they really couldn't tell the difference. Even though they had real needles before, they couldn't tell the difference between sham and real acupuncture. So most women thought they were getting the real thing. Yeah. And it didn't matter if they had acupuncture before or not.
With regards to acupressure, so, could it be that you're getting a positive, not a placebo? Can you take me through?
Yeah.
Is it an accepted sham?
It is an accepted sham from a scientific point of view, but I think it's also accepted that it's not a perfect solution, and there are many problems with it. So obviously one argument is that the pressure and the sensation on skin and even surrounding muscle, is enough to produce an effect. And also, even though we tried it on non-acupuncture points, it didn't seem to make any difference. So both groups had the same effect, really. And it's a real wicked problem because if you think about it, you've got to have the patient or the participant rather believing that a needle's gone through the skin. How do you simulate that without that sensation? And people have tried different things. They even tried sort of lying a patient down and showing them this mock video of pretending to needle them, but it's not actually their hand. And
that's like a phantom limb type thing, is it?
Yeah, it's like a phantom limb type thing. Yeah, but obviously that's that's not really translatable to a large clinical trial. But I don't know the answer to it, to be honest. But I think the theory that we went with when we chose sham was that a lot of the teaching in acupuncture says, it's not going to work unless we have the needle sensation, that's called. And my accent's terrible, so I believe it's called de qi, which means the qi has arrived. Yeah. And from a physiological point of view, we believe that happens when you put the needle in, you twirl it, and then the little muscle fibers will wrap around the needle, and you'll get that sudden sort of
rush.
It's quite marked, and so patients will say, bruising. "Oh yeah, that's it," or "I can feel, it's numb, or it feels like there's some pressure, or it's warm." Yeah. And we are taught traditionally that you need that sensation in order for it to work, and physiologically it makes sense because that's the sensation that would stimulate the small diameter nerve fibers that carry pain and temperature and so on, and that sort of activates that pain matrix. But having said that, there's branches of acupuncture that, for example, Japanese acupuncture, that don't require that needle sensation and that still seem to have a clinical effect. So these arguments against that as well.
We've answered part of it, as usual, but not the full.
No, but I think that the thing is that with hot flushes, it was a subjective measure. So women had to count their hot flushes and so on. I think it probably doesn't matter as much with an objective measure like weight or insulin resistance, because there's not the effect of expectancy or placebo with that. But having said that, I think, as I said, I think it's really compelling that there were systematic reviews that showed a difference in weight between real acupuncture and sham acupuncture.
I'm just hooking on to a point you made about hot flushes and your previous research there. Like I do concede that there are marked differences shown when women have a positive outlook of their menopausal transition as opposed to a negative outlook. And so they,
absolutely,
just from changing their mind, that they actually gain benefit. So there is always the issue of the placebo response whenever you're giving a hands-on therapy to a patient. Indeed,
absolutely.
Professor Frank Rosenfeld looked at cardiac research with this at Melbourne, at Alfred Hospital in Melbourne. And just by doing a foot massage, they decreased nociceptive stimuli, they decreased pain medication requirements. So notwithstanding that sort of aspect can be quite powerful, do you see biochemical changes, measurable changes that you can go, there is really something happening here?
Are you talking about hot flushes? Or
hot flushes, the measurement of hot flushes is controversial. What are you looking at? Adrenaline? It's not there. So
there's no biomarker for hot flushes.
Yeah.
I think that was the problem. Yeah, there's no biomarker. You could use a thermal skin conductor to measure how sweaty women are, so how many hot flushes they have. Yeah. But that's quite expensive, and it doesn't actually correlate to how many hot flushes they think they're having. But that's the real thing, that it's what's important to the women is how many hot flushes they think they're having.
So a subjective measure in this case really is the best that we've got.
Yeah, exactly. It's a completely patient-reported outcome measure. You can't do estrogen levels; it means nothing. And so that was really the best that we had, which is why I'm really interested in PCOS and metabolic conditions, because they are biomarkers that we can measure. So, for example, in the trial that we're running, we're hoping to get some funding to measure how glucose and insulin changes after giving women a specific dose of glucose. So that's the 2-hour-old glucose tolerance test.
Yep.
And that's a gold standard marker for insulin resistance.
Yeah.
And also looking at things like testosterone levels and obviously weight. And we're looking at heart rate variability and to see if that improves, because that's a surrogate marker of sympathetic tone.
Gotcha. Okay. So number of things here. So you've got gross measurement, things like weight. You've got biochemical measurement, testosterone, other hormones. You can calculate the HOMA-IR from your results from the glucose tolerance test. So you've got all this.
Around the curve insulin.
Yeah. So you've got a battery of tests that you can measure. Okay. So I've got to ask, what's your experience? We haven't got the research maybe yet, and I don't want to give too much away, I guess, because you will be speaking at the ATMS Symposium in September about this. But what are you feeling so far, and what's the practice?
Well, we're only just starting with this. So we'll be opening up to recruitment very soon. So we won't have any preliminary data even in September yet. But what we do have is some qualitative data from focus groups that we ran last year in women with PCOS, and really asking them, look, what do you think? Would you try acupuncture? What's been your experience with PCOS? What have you tried? What works and what doesn't? And it was really interesting, because women talk to us about their weight loss journeys and their weight loss struggles, and how they've literally, quote unquote, I've tried everything known to man. I know how to lose weight, but then the weight just stacks back on.
Yep.
I've been doing this for 30 years and I'm sick of it. Now I'm really worried about getting diabetes. I'm really worried about, the future for my daughters. That's why I want to participate in this sort of research. so I think there's a real need to find solutions for these women. They are concerned about long-term consequences. So there's reports of increased risk of diabetes, so possibly 4 or 5-fold, and possibly of increased rates of heart disease as well. But, a number of them are struggling with their fertility issues. There's anxiety and depression is more common in women with PCOS as well. And then there's the weight. And there's the physical signs of the excess facial hair, which a lot of them struggle with, and acne. And so they talk about this, what they call this, it's the whole package deal. They feel really cheated, sort of handed this package deal of infertility and weight struggles, and growing a beard. And they said it's so unfair. I think it's like I'm turning into a man, and I really want to find a solution for this. And they all said, look, I'd be happy to participate in a sham control trial. And that's no problem because, I understand the scientific need for it.
I also think it's important to mention appropriate management, because you're dealing with sometimes not just controversial but really dangerous things here, anxiety and depression. You really need to think about appropriate management. So how do you wend your way there, being duly qualified in medicine and also TCM?
Yeah, look, I am a GP first, and I practice in quite a conventional clinic. So I would do everything that a regular GP would do. And we're very lucky in Australia to have had the first guidelines produced a few years ago by the Centre for Research Excellence in PCOS, that I've received funding from, and some of the speakers from at ATMS are also part of that CRE. And those guidelines very clearly set out the importance of screening for anxiety and depression and appropriate management, the multidisciplinary management of PCOS, as well as the evidence for different treatments for fertility, for lifestyle and managing weight, and so on. And there will be a new set of international guidelines released soon, as well as I believe an app for women to manage their PCOS. So we're really lucky in Australia to have world leaders in PCOS management, working on translation of these guidelines to practitioners. And so I'd really urge all the practitioners to come along and listen to Rob Norman and Nigel Steptoe and other people, because they are really well ahead in their field.
Oh, well ahead.
In PCOS.
Yeah, I'm a little bit scared of interviewing Michael Steptoe because his knowledge of physiology. Oh my God, it outpaces mine like nothing else. But I think practitioners are going to learn a hell of a lot. That's in September 2018 for listeners. So you go onto the atms.com.au website, go to events and look under there for registration of that event. When you're looking at appropriate management, safety, so I mentioned that thing about adjunct therapy. Where do you feel the place of integrative medicine is, or integrative medicine approaches are, with regards to polycystic ovarian syndrome?
Oh, that's a really good question. I always think of complementary therapies and acupuncture as an adjunct. So, for example, in the study that we're about to open for recruitment, it is acupuncture as an adjunct to lifestyle interventions for managing weight and PCOS, and that's the way I think about it. As a general rule in clinical practice as well as research, and I think it's a really important angle to go for, that I am not comfortable with alternative medicine, which is the rejection of biomedicine. I think we have so much to gain from utilising, the advances that have been made and are being made all the time in biomedicine. I understand that the troubles that some patients have had with their experiences in conventional biomedicine, but I always encourage all my patients to to use, I guess, the best of both worlds, and that was the reason I've done I've studied the two professions and tried to bring them together, particularly in the research field. Is that I think they both complement each other beautifully. I think there are a lot of advantages to modalities like acupuncture, tai chi, yoga, mindfulness. They're non-pharmaceutical, so you're not bringing into the mix, the issues of, well, what are the pharmacokinetics of this? How is it going to interact with other medications that I'm on? What are the adverse effects of taking an ingestible? So I like the fact that there's a lot of safety data on acupuncture. So there have been 4 very large studies looking at safety. And we know that overall it's a very safe procedure. And so I think, the adjunctive approach absolutely is the approach that I take.
Of course, there's the obvious one, and that is that you get 100% compliance.
Hopefully.
Well, unless you're chasing them around the room with a needle.
Yeah. I think with particularly with acupuncture for metabolic disorders, I think one of the really interesting things is not just the adjunctive approach, but it's that is it synergistic? So if we think about telling women to reduce calories, and so I'm really interested in whether the acupuncture is going to help them with that because of the possible effect on appetite suppression.
And will you be measuring, things like cholecystokinin or ghrelin or alpha melanocyte stimulating hormone or any of these sort of biochemical surrogates?
Yeah, we thought about that. We thought about leptin and ghrelin. And the advice from Lisa Moran, who's a co-investigator in part of the CRE, is that it's not the best biomarker for what we're looking at. You really need to, for appetite, you really need to have a sort of all-day thing where I think you sort of measure how much women are eating, and that's very long and drawn out and very expensive.
Yeah, it needs to be in a lab.
We won't be doing that. Yeah,
Gotcha.
But we are measuring some patient-reported outcomes. I think weight, self-efficacy, so how confident women feel in controlling their eating in different situations, like watching TV or out in a social situation.
Gotcha.
And that's a validated scale. So
right. I think that's the issue, though. As long as you're using a validated scale.
Absolutely.
You spoke about leptin, but if you've got leptin resistance, well, that's not going to help you measuring leptin because we know that obese people can have high amounts of leptin. So what's the point?
That's right, yeah. So you need to be able to interpret it. It's got to be useful clinically.
Yeah. What about future research? What are the sort of hot topics in acupuncture at the moment? And, where's our direction of inquiry heading? Certainly not just pain.
Yeah, certainly not just pain. And my interest is in the role of acupuncture on dampening down that fight or flight response, and then the effects on weight and metabolic conditions. So another sort of hot topic for me personally is looking into the role of acupuncture for weight loss in breast cancer survivors. So we know that after a diagnosis of breast cancer, women do tend to gain weight, and it's probably multifactorial. It probably is related to treatment factors, but we also know that this can increase the risk of tumour recurrence and I guess worsen prognosis overall. Yeah. So the next step for this is to run a similar pilot study on women with early breast cancer, again to see if there's an adjunctive effect of acupuncture on weight loss. So I've in the process of just looking through results from a national survey that I ran through Breast Cancer Network Australia, where we had over 300 women tell us about what happened with their weight after breast cancer diagnosis, what they've tried, and we're looking at whether or not we can predict those women who are at high risk of gaining more weight, and then target an intervention that can help them maintain a healthy weight and improve their long-term health outcomes.
Carolyn, can I ask you just to give us a little wrap-up, if you like, of some of the safety aspects and indeed registration aspects with regards to acupuncture in Australia? Because I hope I'm not overstepping the mark here, but are we getting to the over-medicalisation of acupuncture? Are we losing the rich history of traditional Chinese medicine by just doing this pain-related acupuncture? Obviously, you're not doing that, but I'm just wondering, are we losing the rich history of acupuncture?
Look, that's an interesting question, and I think the history will always be there. And we use the history all the time. For example, we use the diagnostic principles in coming to a acupuncture prescription. So I use that for the menopause study. We're using that in PCOS, and we'll use it in the breast cancer study as well. But if you look at what's happening in China, where the use of acupuncture and Chinese herbal medicine is really quite mainstream, they are the experts in I guess bringing the two worlds together, so Western medicine and Eastern medicine, and so they will happily combine Western medical prescriptions with some acupuncture and some herbs, and go and do your Tai Chi and go and have your Chinese massage as well, and the Chinese diet therapy. So it's all wrapped up in one. And in fact, I know that the Chinese doctors in China are allowed to prescribe, and they do practice Western medicine in a way that they can't here. So I hear what you're saying, and that are we losing that history? I think it's really fascinating, really unpacking, the mechanisms of acupuncture. And while I find the philosophy and the different diagnoses really interesting, I also think, they were, I guess, formulated in a time where we didn't have the mechanisms that we do now to sort of look into the human body. So we can't, they didn't have pathology, they didn't have radiology, they didn't have lots of different functional tests. They can't look at the microbiome and start looking at epigenetics. Well, that's another hot topic. That,
that would be really interesting. Oh, my goodness.
Yes, I know. So I think, having the two come together is not losing anything. I think we're gaining a lot. And I think it would just increase the translatability of acupuncture. And that's the eventual goal, I think, that we can show, what works, how it works, and ensure that it's provided safely and appropriately. And you asked about registration as well. I don't know if this is a topic that's come up in other podcasts, or do you want me to go through that?
Yeah, just a little bit, because you're dual qualified, whereas you'll get a lot of doctors who have done medical acupuncture, which is called, forgive me if I get this wrong, is it called dry needling now?
Yeah, so dry needling is a different thing altogether. So dry needling doesn't use any acupuncture principles. It really is just using an acupuncture needle and putting it into a trigger point.
Gotcha.
So it's often done by, musculoskeletal doctors or by physiotherapists. So medical acupuncture is when obviously you're using some of the principles of Chinese medicine, but you don't have to do a TCM diagnosis, so you don't have to look at the tongue and pulse. So it's really sort of using that physiological knowledge of how it works. And Chinese medicine is a regulated profession in Australia. So what that means is that all our Chinese medicine practitioners have to be registered with the Australian Health Practitioner Regulation Agency under the Chinese Medicine Board. And this is this was a really important step forward, I think, and we're still the only Western nation to nationally regulate our practitioners. So chiros and osteos are again under the same scheme, and I think it's important because acupuncture is not without risk. It needs to be done under certain conditions to reduce the risk of infection, for example. And also, there are new guidelines that were released a couple of years ago by the Chinese Medicine Board about safe prescribing of Chinese herbs, and there's a separate registration for dispensing as well.
Okay.
So taking into account the potential safety concerns of herbal medicine, it is important that this profession is regulated. And it increases the credibility of the profession as well to conventional health practitioners. So I think my boss, Alan Bensusan, the director of Nickham Health Research Institute, was one of the founding people to put that paper, that publication together to drive the move towards regulation. And my mentor and PhD supervisor, Charlie Shuey, set up the Victorian board, and now it's national, and I'm on the reference group for the board. So I fully support registration. I think it's a wonderful thing. The job of the board is to protect the public, and I think that can only be a good thing.
Yes, that's absolutely well said. And I got to say, hats off and good on you for your work thus far and your future work. You've worked really diligently with registration, with your work with a lot of women's groups, with looking at, hot flushes previously. Now you're going to be looking at polycystic ovarian syndrome. Can't wait to hear you speak at the 2018 ATMS Symposium in September. That'll be fantastic. So I just thank you so much for taking us through the acupuncture aspects for polycystic ovarian syndrome today on FX Medicine.
Thank you. Thanks so much for having me.
This is FX Medicine. I'm Andrew Whitfield Cook. Don't forget to visit fxmedicine.com.au for today's show notes, extra research and other resources.